Hi guys, we're super delighted for everyone to join us. The presentations so far have been really intriguing and we're really excited to share about our project. So for those who are watching this recording, it is July 16th, 2022. But before we get into anything, I think we should give some of our personal introductions. So, hi, I'm Emma. I'm a rising senior in Toronto, Canada, and I really like the integration of technology in different sectors. Personally, I just like technology as a whole. I just think it's really interesting to see how tech can be used to improve current systems by making them more efficient. So, other than healthcare, I've been looking a lot more into productivity and mental health, where I just created a few projects, one of them being a customizable productivity site.
Hey everyone, Ashley here, grade 12, also from Toronto, Canada. And for me, my passion lies in the intersection of global health and diagnostics. I think it's really cool how you can make a lot of handheld devices in your bedroom and then use them to detect things that you can't see. And aside from this project, I'm also building a low-cost biosensor. I love chemistry and bioengineering. This low-cost biosensor for population assessment of vitamin B12 in low to middle income countries. But first, before we actually talk about our project, I want you to imagine there are 100 identical people in a room. 10 are starving and you have 10 apples, but you can't really confirm who's starving or not. So how do you give away all 10 apples so that no one is hungry anymore? And this is why diagnostics in the field of healthcare are arguably just as important as treatment, because you cannot treat what you can't find. In rural Ghana, over 80% of village level clinics don't have any lab equipment because either it's just really expensive or two, there are no doctors in the region. Because while the recommended doctor to patient ratio is Canada and in the majority parts of the states as well, the doctor to patient ratio in rural Ghana is 1 to 15,000. So this is placing clinical diagnosis far out of reach to many who need. And so as a result, 50% of those with respiratory diseases are either underdiagnosed or misdiagnosed. And this means that 50% of those who need are either unable to receive medical support or they receive the wrong kind of medical support, both of which are really harmful to the body. And ultimately, this is just leading to huge gaps of quality of life internationally.
So our vision is to bring accessible and more accurate respiratory disease diagnostics to rural Ghana so that they can be treated properly. So how we're doing this is by developing a smartphone algorithm that can detect diseases via forced cough recordings. So this creates a low-cost, easy-to-use device that healthcare workers of limited experience can use in low-resource clinics. So the way it works is via machine learning, which is a branch under the field of artificial intelligence that uses data to create its own algorithm. Just like how we learn not to do things through mistakes or figure out better ways to do things over time, machines can learn in the same way too. As humans, we feel of something we did, which allows us to make judgments of whether or not we should do it again. It works similarly for machine learning, except their version is more mathematical. It's either losing a point or gaining a point, and their algorithm is built to figure points over time by using data. This makes it very useful when you want to perform classification, but you have no idea what the differences are. So in our project, Ashley and I don't exactly know the differences in cough sounds between respiratory diseases, but we can train an algorithm that will be able to find these differences and make these predictions.
We first began by building a prototype because we weren't even sure if you could use coughs to distinguish the sounds of multiple different respiratory diseases. And so basically we started off with collecting data. So we just scoured the entire internet for any cough recordings that we could find. We got some crowdsourced data for asthma, COVID-19, and some from healthy subjects. And then we reached out to a couple of researchers. We got some COPD data as well to throw into the mix. And in total, we got about 90 recordings for each category. So we were working with 350 in total, which wasn't a lot, but it certainly was a decent amount to work with. Afterwards, we had to standardize the data. So first, the data that we gathered, it was really sketchy. Get more accurate results if you standardize the data and you do make your data as uniform as possible. So this did involve a lot of what is known as audio pre-processing. So basically we just normalize bit rates and amplitudes. Then we applied a low pass filter, which basically filters out any background noise. And then we did these things called peak detection and we drew amplitude envelopes. Essentially, this would help to segment out individual cough recordings, and then we shortened them all to be the same time length.
So in a nutshell, after we pre-process all of the recordings, we turn them all into spectrograms, which are visual inputs of audios. So in doing this, we could take advantage of an image classifier, aka a convolutional neural network, to analyze the images and create a self-building classification algorithm. More specifically, in our case, we used a transfer learning model, VGG19. Essentially, a transfer learning model is a model that has already been trained on thousands of random images. It's very adept at recognizing all sorts of shapes and lines, aka features, and by using a pre-existing algorithm that is already skilled at classifying images, adapting it for a new purpose would allow us to use our very limited data to build some sort of working algorithm that was actually smart and wasn't just making predictions based off of a coin flip. So after we trained everything, we achieved about an overall 75% accuracy, which showed great promise in using cough cells to detect multiple diseases at a time. So as you can see over here, this is our prototype. At the top, we have our cough recordings of all the different diseases and our categories, which is COPD, asthma, COVID, and healthy. At the bottom, we have our model, and that is going to be predicting what each cough recording, what category it is in. As you can tell from the file name and the prediction printed out, they all predicted it correctly.
So after seeing the potential with our prototype, we did get really excited. We wrote a research paper for IE's Global Health Conference, and we'll be attending there in the fall, which is really exciting. And throughout the entire process, we have been collabing with Dr. Rich Fletcher from MIT's Mobile Tech Lab. Here's a cute selfie moment too, we would also like to acknowledge. And we recently partnered with the OKB Hope Foundation. They're basically a nonprofit organization working to bridge the healthcare gaps in rural Ghana. And they're really excited in algorithm like this in their clinics. And we're now just working with them to collect better and more cough data so that we improved algorithm that could be used for implementation, since the one that we made before was just a first round prototype. Specifically, we're just interested in collecting pneumonia, asthma, and tuberculosis data, which are the three most common diseases in rural Ghana. And with this, we would also really like to acknowledge Dr. Chris Opong and Asai Botang for all of the support.
Ultimately, you can't treat what you can't find. The struggle to get proper diagnostics is one of the largest barriers to quality treatment or even treatment at all. Our mission is to take massive, costly, and inaccessible lab equipment to test for multiple respiratory diseases and figure out a way to fit it in a single smartphone, a device that nearly every household on the planet has. Mobile health has so much potential, and we must leverage it in our efforts to achieve global health. So thank you so much for listening, and thank you GHLC for giving us this wonderful opportunity. And of course, if you have any questions, feel free to reach out to us.